Hello everyone. Today I'm going to continue the last topic which we discussed already, cerebral palsy management. So in the last class we discussed about the what is the cerebral palsy, what are the causative factors, what are the risk factors, what are the different type of the cerebral palsy, signs and symptoms. After that we discussed about the what are the investigation procedures and also what are the assessment plan. So in this topic, we are going to discuss about the management of the cerebral palsy. So how we are going to manage, how we are going to guide it to the parents as well as the caregivers, how we are going to manage with the complications of the cerebral palsy. So here we are going to discuss about the management. So especially, so this is going to be divided into three phases. So it's going to be the first stage and also second stage and third stage. So in the first stage is going to be the birth to 3 years of age group. So how we are going to manage the cerebral palsy. So in this age group, so for our aims are the main aims are the family education. First, we have to educate the family and also handling techniques and also how to give the proper care to the patients. So handling and care, promote infant and also parent interactions. So how we can improve the interaction between the child and also parents, encourage skills of the functional skills and also play. So we have to encourage, we have to give the guidance how to encourage the development of the functional skills and also play activities with the kids, and also promote the sensory motor development and establish head and neck control, attain and maintain the upright positions. So these are our aims. So during the first phase of the cerebral palsy management. So coming to the family educations. So family education. So we have to educate the families about the cerebral palsy. So in the nowadays, so all the families are not getting the information, proper information about the cerebral palsy. So who are not getting the information, proper informations, so they may neglect the children's or may neglect the cerebral palsy conditions. So it may give the further development of the complications. It may chance to give the serious complications, and sometimes the patients may also die because of the serious complications. So if we give proper educations or proper awareness of the cerebral palsy, so we are going to with the small techniques or simple exercises and also simple precautionary measures. If we maintain properly, so we are going to prevent the serious complication in the cerebral palsy patients. So we have to explain about the how the consequence will be there in the cerebral palsy patients if we neglect the conditions in the without any treatment. So who are having the muscle tightness. So in the last class we discussed about the different type of the cerebral palsy. So if the cerebral, the spastic type of cerebral palsy, what symptoms they are going to face, what complications they are going to get in the futures, are in the athetide conditions, are dystonic type of the conditions, are in the cerebellar type of the cerebral palsy. So what the complications may chance to get if the baby grows or if they get the progressions. So in those conditions, so we have to explain clearly to the families and also caregivers to provide support in their acceptance for acceptance of the. So we have to give the provide the support in their acceptance of the child. So that means, so if any child birth with a cerebral palsy, so we have to give the like a positive support to the family members. That means we have to explain. This is not a, so we have to explain about the cerebral palsy conditions. So the patient, the family has to accept the cerebral palsy patient's child. So sometimes some parents are not interesting to take care of the child because of the they having the so many disabilities. So that is a person to person vary. The family members are going to be sometimes mother or father. They may chance to get the like they won't accept the cerebral palsy patients. So if we give the proper education about the cerebral palsy, so they are going to accept the cerebral palsy patients and also they are going to be cooperate to the treatment plans. So especially for the rehabilitation and physiotherapy and what are the treatments are available for the physiotherapy and cerebral palsy. So they are going to encourage, also they're going to spend the time for the cerebral palsy patients. Otherwise they may chance to get the neglect and also may chance to leave the child in the any orphans homes, or maybe some families are may do like this they can maintain the child in the orphans home. So you should not maintain, they should not give this much of that means awareness. So we have to give in the positive way, so then only the family can get awareness and also they can accept the child. and also goal settings and also programming should be done with the family. So everything, so what we are going to plan, how we are going to do the procedures for the treatment procedures, what we are going to encourage the activities along with the family members, so it will be easy to practice the plans and also activities with the child, and also the child also very is going to be adapt to the family members. It will be easy to the patient as well as the family members, and also therapist also going to be comfortable. So if we combine together with all the whole the family, so be realistic about the prognosis and efficacy of the physiotherapy while remaining hopeful. So that means, so we should not, the therapist have to explain clearly. So that means, so they have to explain, so what the benefit will get with the physiotherapy, and also what are the rehabilitation therapies, what are the exercise benefits. So all these things, if we explain properly, so the family can cooperate, and also the family can spend time with the cerebral palsy patients. And also we should not, the therapist and also should not bluff about the prognosis, or maybe should not give the false comments or false information to the family members. So whatever the possibilities, so depends upon the practice, how much they are going to be practiced with the patients, so they are going to get the improvement will be more. So that is depends upon the type of the cerebral palsy. In case of the dystonic and ethetoid type, so sometimes the progression will be not only the physiotherapy and also rehabilitations, so it will be depends upon the medical management. So in those conditions, so because of the tremors cannot very difficult to manage, or also involuntary movements are difficult to manage. So in those conditions also, we have to give the information clearly to the family members. Otherwise, if they, for example, if the patient having the ethetoid and dystonic type of cerebral palsy, if therapist says, if they give the false information that says that if this patient is going to get improvement within the 1 year, so we will be all right. So this type of statements sometimes may give the a false recovery, and may chance to get the bad opinion on the therapies. So that means if they won't get any improvement. So that's why we have to give the genuine information to the family members. Honesty and also commitment towards the child. So the family people also have to spend the exact time, accurate time. That is also is a precious time with the child while doing the exercises, while doing the rehabilitation programs. So whatever we are giving the therapies to the patients, so the family members and also caregivers should be commitment. So should be give the time. So nowadays everybody have the busy schedule, busy with their work environment, and also busy with other activities. But if we give the commitment to the child, so that the improvement will be is more, and also it will be accurate. Listening to the parental concerns and recognize the personal values and also strength. So the therapist also have to listen to the a parental concerns. So they have so many some personal values and strengths also, or sometimes some beliefs. So the therapist has to follow their parental concerns, and also recognize the personal values and also strengths. So according to the families, that means the family concerns. So the therapist also has to work so along with the family members. So that means if he educate properly, so the improvement will be is easier, and also the adaptation to the child also will be easier. And so coming to the handling and also care, so these are also you should be careful. So we have to do the promote parent ease and also skills and also confidence in the handling child. So we have to give the proper education to the parents. So how to handle the patients, how to hold the patient. So so if we give the some precautionary measures and also some training to the parents, so they are going to handle very easily and also care about the patient very easily. So in this one, so many techniques such as the positioning techniques, feeding techniques, carrying techniques should be taught. So who are the therapists or rehabilitation therapists or physiotherapists, occupational who are involving in the rehabilitations. So according to their area, so they have to explain about their concerns. For example, physiotherapists so have to explain about the motor functions and also sensory functions, how we can improve their strength, and also how we can improve their walking pattern and functional activities. So all these things have to explain clearly to the family members. And also while giving the feedings, so the speech therapist and speech pathologist have to explain so what type of the procedures So all like a OTs, occupational therapists and physiotherapists, speech pathologists have to all group like a team of the members, have to explain clearly to the family members so they can maintain the proper feeding techniques and also carrying techniques. So if we give the proper informations, they can follow, they can train the child, and also they are going to get the good improvement. Promote symmetry and limit abnormal posturing and facilitate the functional and motor activities. So is promote symmetry. So that means how to encourage all the activities in a symmetrical manner. So that means if any upper limbs are is not working properly, so how to give the training to the both right upper limb as well as the left upper limbs. So the activities should be in the symmetrical, and also limit the abnormal postures. So if any abnormal posture or maybe the forward postures or maybe flexion postures, so in this flexion postures, so we have to avoid the abnormal flexions. So while carrying and also while sleeping positions, so we have to avoid the abnormal postures. So I'm going to show you how to avoid the abnormal postures. So if we avoid the abnormal postures, so we are going to get the good improvement. So we can prevent the reflexes, abnormal reflexes. If we prevent if we inhibit the abnormal reflexes, so we are going to improve the motor functions. Use variety of the movements and postures to promote the sensory functions. So the movements also, so if we avoid the abnormal movement, just now we discussed, so some positions are helpful to prevent is inhibiting the reflexes. So such as like a mat activities are reflex inhibiting postures. So reflex inhibiting postures means such as the mat activities, such as the like a in case of the like a quadruped positions, are the hands and knees, and also and also quadruped 4-point positions. If the patient is the hands and knees positions, so it will be stopping the flexor reflexes, or who are having the like a tightness in the flexor compartment of the hands, or maybe in case of the, so it may use the stretching to the flexor compartment of hand, so it gives the stopping the reflexes in the upper limbs, so it will reducing the tone and also helpful increasing the functional activities. Or maybe in the kneeling posture. So if we give the kneeling, so we are going to give the kneel standing. That means the patient will have to maintain in the stand and knees. So this posture is going to be helpful to increasing the stretching in the hip flexors. So these healing positions. So it may give the reflexing the, or is stopping the reflex in the hip flexors. So it will help to reducing the muscle tone in the hip flexors and also improve this erect posture and the standing and knees also. It controlling the abnormal postures. So it improving the strength in the balance and also improving the like coordinations. And in case of including the positions that allow the lengthening of the spastic and also hypotonic, hypoextensive muscles. Some positions, for example, if we give the standing positions with support, so in the standing positions, if the patient's having the tightness in the hamstring, or in case of the, if anybody having in the calf tightness, so if we give the standing positions, so because of the is a hypertonicity of the spastic muscles, or hypertonicity or spastic muscles in the hamstring, our calf muscles are going to be strengthened, and also it will get the stretch and also it get the flexibility. It leads to the is elongation of the muscles, so we can prevent the abnormal like a postures with the static postures. And also use positions to improve the functional voluntary movements of the limbs. So if we give the proper positionings, so we are going to give the like improve the voluntary movements. So for example, in case of the like just now we discussed the quadruped positionings. So that means like a crawling positions, how the baby can crawl, the same positions if we give to the cerebral palsy patients. So what happened? So because of the hands positions and also knees positions, so he's going to get the strength to the shoulders and also stretch to the stretch to the forearm like a wrist flexor. So it will stop the extensor. I stop the like a hypertonicity. So it will help to improve the movement and voluntary movements. So these are the important positionings. So sometimes, so if in the baby the supine lying positions, we should not give the like without supporting to the head and also without supporting to the limbs, we should not give the positionings. So in the supine lying positions, so these positions are going to be increasing the reflexing activity. It improves the abnormal postures. So they are going to get the flexion again. Still, they are going to get the flexor tone is going to be increased. So that is the reason. So we should not give the without support. We should not give these positions. To avoid these positions, so we can maintain the like a support in the head and also upper limbs and the lower limbs. So these things are going to be inhibit the abnormal reflexes. So it will help to reduce the muscle tone. So this is the poor positions because of this head is pushing back and also turn to one side. See here, the head is turned to one side and also pushing back. Hips turning causing the legs to cross. So because of these positions, so hip adductors are going to get the tightness. It may chance to get the scissoring gait. The legs are going to be crossed. So because of the rotation of the hips, so it may leads to the tightness of the hip adductors. The feet are pointing down, and also which means that they can't get them into flat if she is sitting. If she so that means in these positions, so the plantar flexors. So if you see here, the feet are pointing downwards. So this is because of the tightness of the gastrosoleus muscles. So this is the wrong positions. So it may increasing the tone. It may develop the hypertonicity in the gastrocnemius and soleus muscles. And also hands and arms away from the body. If you see here, away from the body, so it may leads to the see here, it's away from the body. So it is going to be, if you see the right side, is a flexion of the upper limb. So it may increasing the tone in the biceps. It may use the arm flexion deformities, elbow flexion deformities. And also if you see here, the hands are going to be fisted and closed. So these positions are going to be increasing the tightness in the wrist flexors. So these muscles are going to get the tight. So may chance to get the flexion deformities and also fist making. So this also flexion deformities. So that's the reasons we should not give these positions. So to avoid these positions, so we have to make them into maintain the head in the neutral positions. And also if you see the foot in the like against to the like a bed or is against to the wall. So this position is going to give the stretch to the gastrocnemius and soleus. So we are going to prevent the hypertonicity in the calf muscles. So this position facilitate the accessibility to independent limbs and also head movement. So in these positions, head should be in the midline. So this is the best position to avoid the abnormal movements or abnormal tone in the cerebral palsy patients. And coming to the prone lying positions, so this prone lying position also, we should not give it without any supports. We should not give the prone lying positions. So this also, so is going to be the legs may be crossed. Here also the legs may be crossed. Hands are in the fist, so they are going to make the fist. And also she can't do anything in these positions. So if you make them the support to the lower part of the body and stabilizing the pelvis with the support, so if the remaining part is going to be she's going to be the play with any other activities if you give any toys. So in these positions, the baby they can and also the child can try to lift the head. So may chance to we can improve the head control and also neck control. So this will be the best positions in the prone lying positions. And also sideline positions. So this sideline position also we have to give in the proper positions. So we have to give the support to the head and also upper limbs. So that is the downwards upper limbs. And also we have to give it to the support to the is a like a upper like a lower limbs. So these things if we maintain, so we can prevent the like a abnormal reflexes. So we are going to enhance we can control the abnormal postures. So this also in the sideline positions, if you give proper pillow supplications, so these are going to prevent the abnormal reflexes. Coming to in the sitting positions, so if you see here in the sitting position, the long sitting positions and also slouching posture, that means the patient is in the mother's lap and also there's a long sitting positions, but is getting the curvature at the thoracic levels. So that means is going to be the flexion deformities. Again, is going to increasing the muscle tone in the flexor compartments. So we should not give these positions. And also we should not carry the baby in the mother's lap in the flexion positions. So in also if it is in the lap also, the baby is in the mother's hands, so should not be in the like a extension position of the neck. We should be in the neutral positions. So we have to avoid also in the proper sitting positions. Or in the sitting positions, if it's possible, we have to maintain the hips and knees are 90-90 positions on the mother lap, on the mother's legs. So here on the thighs, we can maintain the 90-90 positions. If you bring here, we can maintain the head in the neutral positions. Otherwise, here the baby's head is going to be the extension positions. So that means there is no control in the neck. So if it's possible, we can give the any wedges, or we can give the any like a Swiss ball on the Swiss ball, or maybe the bloster. We can give anything to avoid the like a scissoring pattern of the legs. Or otherwise, if we give this positioning of the baby over the mothers or fathers and the leg, so one leg should be is the opposite side. So that means one leg inside the leg, and also other leg should be cross the other leg. So if these positions, so in these positions, if we give some training, so they won't get any tightness in the hip adductors, as well as if we give some balancing activity on the mother's leg, so they may, if you hold the baby on the leg, so try to give some movement and also tilting movements, so they may chance to get that means that they are like a postural control. So it's going to get the strength in the trunk muscles, so it may helpful to improve the strength in the trunk. So these activities are important while playing the kid, and also while holding the baby. So these things, if the parents spend the precious time with the kid, so it's going to be improve the so many functional activities, and also strengthen their balance, and also they're going to be improve the muscle strength in the uh, uh, trunk as well as in the limbs. And coming to the sitting positions, so if your sitting positions also in the wheelchair or in the bed also, if you give the improper positionings, so there is no positioning properly, there is no support to the head, there is no proper support to the limbs. So is abnormal rotation. If we see here, the hip is rotated external rotations, and also is going to be is also into external rotation. So if there is no proper support to the head and also back, so it may give the other complications, and also may chance to get the deformities. So if you want, so if you see that in the wheelchair also, or in the scooter, so if the baby is not sitting properly, so if there is, so here there's a hyperextension of the neck and also back, and also these positions also going to be tilted. So the deviation of the spine to one side. So they may chance to get the spinal deformities such as the scoliosis, or maybe may chance to get the kyphosis. So for these conditions, so if we give the proper positionings in the sitting with the support to the back, and also proper placement of the supportive pillows, and also give support to the knees, and also below the knees, if we give support, so we can maintain the posture and also prevent the postural abnormalities. So in the sitting posture, also in the wheelchair, so if we give the like a space between the both legs, so if you put any wedges or any, you can the blaster, small blaster, or any roller in between the two legs, so we can prevent the tightness in the hip abductors, sorry, hip adductors. And also coming to the positionings while doing activities, so we should give the proper chair and also a proper table to give the support, so to prevent the flexion positions. So if there is no support here, so they may chance to lean forward, so may chance to get the chest wall deformities and spinal deformities. And this is the very, very important positions who are having the abnormal sitting postures, so also called as W sitting. So this is the important positions. So W sitting is most commonly seen in case of the delayed milestone, or in case of the Down syndrome, autism, or especially who are having the like if any neurological, especially is the in case of the neurological injury, so may chance to get the like a W sitting. If you see here, the legs are going to be, hips are going to be internally rotated, and also is outwards. So these knees are going to be like a knock knees. So here is going to be like a W. So this is going to be the 1-2 stroke, and this is the W sitting. So if this W sitting is going to be actually, if you are already in the rehabilitation practice, so they can easily understand. Actually, no one likes these positions. They can understand. So how much the dangerous this W sitting. So whenever in the families or in the child, any child get these positions, try to avoid these positions, because of it may damage to the hip joints and also knee joints and also ankle joints. So it's going to be affect because of this simple posture, the abnormal posture. It affects to the all the joints are going to be affected. It may lead to the damage to the ligaments in the knee joints and also hip joint and also ankle joint. And this position is can hurt the knees, hips, and hips and also hip of the child. So she does not need much control to sit like this. So she does not need to learn to practice. So this is the simple sitting. So most of the kids are going to be adapted to this position easily. So who are understand about the W sittings. So if we avoid these positions, so we are going to prevent the complications in the especially lower limbs. So she does not learn to develop a good sitting balance if she is always in these positions. She may therefore never learn sit with a good balance in any other sitting positions. So if they adapt to these positions, so if we won't avoid these positions, so they're unable to sit properly in the other positions, they won't be comfortable in other positions. So if you train in the other positions, in the cross leg sittings and also like a long sitting positions, so we are going to prevent the double sitting. And also these positions are that they may learn the new sitting postures and new learning techniques in this cross leg sitting and also in the long sitting positions. So if you avoid these things, so who are having these double sittings, so we have to give the long sitting positions and also cross leg sitting positions. And also we have to strengthen so which muscles are weak and which muscles are tightness. Especially so those who are having these positions, so may chance to get they're going to get the internal rotation. So we have to like a plan to do the external rotations. So we have to improve because of the weakness of the internal external rotators, so may chance to get this internal rotation. So we have to avoid, so we have to encourage the hip abductor strengthening as well as hip extension, external rotation strengthenings. These things and also strengthening in the lower limbs, we can prevent this like a W sitting. So if we prevent this double sitting, we can give the special strengthening techniques in the squatting positions and kneeling positions, half kneeling positions, and also single leg standing and double leg standing, lunge position. So these things are going to be improve the strength in the lower limbs for the cerebral palsy patients. And also standing positions. So standing positions. So if you see here, we have to encourage the best standing positions if the patient is unstable positions. So if you see here, the patient is sitting and also holding with any table, but it's not balanced properly. So this is the very poor position in the standing. So we should not encourage without support to the trunk and also without support to the limbs. So it may give the abnormal posture. If you observe this patient, so this child, so lean forward. So if you see the postural changes, abnormal postural development, so he already leaned forward, and also here he got the flexion deformities in the hip as well as the flexion deformity in the knees. So we should avoid these positions. Then we can give the seated and also supportive devices with the standing frames, with is a modified standing frames to according to the age and also height of the patients. So these things we have to give the support to the trunk as well as support to the lower limbs. So we can give the support to the upper limb. So if you may give the support forward, like in the front side here, if the patient holding in these levels, so they are going to maintain the posture in the erect postures. So this is the best positions to avoid the abnormal movements in the standing positions. So depends upon the patients, or we have to like give the different type of the standing frames in the stand. We can give the we have to give the like a crossing to it give the space between the two legs. This also prevent the tightness in the hip adductor tightness, and also it gives the strengthening in the back and also prevent the like a postural abnormalities. And we can give the some like a tilting model. So in this tilting model also, if the patient is in the standing on the like a table or maybe in the like a ladder, so we can give the patient is going to be lie on the or lean to the ladder or maybe this standing frame. So is going to maintain the stretch to it gives the stretch to the gastrocnemius and soleus, and also stretch to the is the iliopsoas muscles. So because of these postures, so these hamstring muscles are going to be stretched, gastrocnemius muscles are going to be stretched, and also iliopsoas muscles are also going to be stretched. It maintains the erect posture. It prevents the flexion deformities. So that is the main advantage of the standing frame. So according to the patient age group, and we have to give the standing frames. And also feeding positions. So feeding positions should be accurate. We should not give the improper feeding positions. So should not give the babies in the completely lying positions. So we have to avoid, and also while giving the patient head should be the slightly bent forward, or is completely is extension positions, may chance to get the is a neck retractions, and also may chance to get the abnormal tone in the neck regions. So if we give front like a slightly elevation of the head, so it may use it may prevent the stiffness in the neck, and also it's going to make the eating and swallowing easier in these positions. And always the patient should be in the mother lap to maintain the contact between if the child age is like less than is the 1 year, or between the 0 to 6 months, the baby always should be breastfeeding, and also it should be very close to the mother. So it will develop the interaction between the mother and also child. So this communication will be easy. So then the if you're giving the feeding through the like a spoon and all these things. So but this the age grows, so they have to maintain always, they have to play and while feeding, and also give some like a toy place and give some showing the objectives and also attractive colors. So these are going to be stimulate the patient's sensory system and also visual feedback. So it will help to enhance their functional activities. And also carrying techniques. So these techniques are so important carrying techniques. So should not carry the in the wrong directions. So who are having the like a flexion deformities or flexor tone is increasing. So should not carry the babies in these positions. So if they want to carry, the parents should be, or maybe they have to separate the limbs, or is that we have to give the hip abductions, and also maybe they have to maintain the hip abduction and holding on the shoulders, or otherwise to maintain in these positions. Or sometimes if they want to hold, so they have to hold in the prone positions. So in these positions, they are going to stimulate the neck control. So that means is going to be stimulate to the neck muscles, and trunk muscles is going to be improve the tone in the neck and trunk muscles. So these are some important positions to avoid the abnormal like postures. So these things, if we maintain these things, so we can prevent some stiffness in the upper limbs, and also we are going to be reduce the stiffness in the hip abductors, and also to open the hips easily. So who are having this tightness in the flexor deformities, so this positions is going to be the usually curl up, so they may chance to get. To avoid these things, so we have to maintain the in the over the shoulders, but should be the hip should be abducted. So coming to the mother and child relations, so we have to encourage the relationship, the bond should be in the parents and also child, because of so this is the who are having the cerebral palsy are in IQ is going to be less, but all the feelings are going to be same. Who are having like the normal like a feelings in the or the cerebral palsy patient also, but these people are going to be more attached with the parents. So if they neglect anything, so they may chance to get the emotional, or they may chance to get the other psychological depressions may chance to get. So that's the reasons we have to activities should be done on the mother's lap, and also close to the baby and face, so that her touch and also stroking, also talking with the baby not only help motor development, but also body image, movement enjoyment by the baby, and also demonstrated love and also security. So they are going to feel more happy if they're feeling, if they're more time spending with the parents. So this is not only improve the motor functions, and also is going to give them more joyful while demonstrating the like any affections, or while they are showing the affection with the child, and also is going to give them more feel like a more strength with the family members. They're going to feel the more security and more strength about the emotional strength. So weaning of the child to the PT therapist should be carefully done after the mother-child bonding and confidence is established. So while giving the treatment, so we should not disturb the relationship between the child and also mother. So we have to maintain, and also we have to maintain the relation between the mother and also child, and also we have to start our therapies, and we should not disturb any relationship between the child and also the parents. Introducing more than one therapist or development workers maybe is the disconnecting to the child and even parents. So sometimes if you change the many therapists, or maybe physiotherapist, occupational therapist, or maybe is a recreational therapist, and also next about the psychologist, or whatever the like a special educator. So if anybody changing so many therapists, so sometimes it may disconnect the, or it may disconnect the in between the child and also parents. So whatever the if the patient if the disconnect, it may chance to get the like other complications. So that's the reasons we should not disturb the relationship between the parents and also child. Not to overload with exercises, but rather than use of the corrective movements and also posture with the ideals of the child. So we should not give the all the like vigorous exercises or so many exercise. So instead of giving so many exercise, if we give the playful activities, because of this patients are going to be, we can say the very younger age, if you give the exercises, the patients may not cooperate sometimes. So instead of giving exercises, the playful activities, it also may chance to increasing the or improve the ADLs, activities of daily livings. So then the exercises So that is the reasons we have to give them with any toy activities and any playful activities. So overhead activities are the any Swiss ball activities or bloster. So it's a playful activities are going to be increasing the ADLs. Coming to the feeding and also respirations. So positions in the proper and also up the sitting for the feedings. So proper positionings have to give in the sitting positions. The patient should not be completely lie down. So it may use the aspirations, may chance to get if they are not swallowing properly. If the food enter into the lungs, so they may chance to get the aspiration pneumonia. So that's why we have to give the feeding properly in the proper sitting positions. For greater hip stability and also symmetry during the feeding positions in a high chair with a high adaptations. So if we provide the high chair and also table, so it's going to give the more strength in that stability in the hip joint. And these positions are going to be head and neck positions should be in the neutral rotations, slight flexion to facilitate the swallowing positions. So slightly, if the high sitting positions, if the slightly flexions is going to be facilitate the swallowing. If they're completely in extension positions, so it's a difficult to swallowing and also may chance to get the is aspiration pneumonia. If the swallow abnormal directions, if the food enter into the lungs, so it may use the infections or pneumonia. So because of the aspirations. Deep respirations can be facilitated before feeding by applying the pressure in the thorax or abdominal area. So we have to give stimulus in the deep respiration techniques. So this we have to apply some pressure in the thoracic regions. So if we give this thoracic region and abdominal regions, so it will increasing the respiration, deep into respirations. It helpful to gives the facilitating the feeding. So these are the some simple technique to facilitate the feed swallowing and also facilitate the sensory motor development. So this is a very, very important, especially so while the playing with the pair like a baby. So the parents have to maintain some positions, so some reaching activities and also rolling, sitting and crawling activities. Transitional movements like standing and pre-walking are facilitated. So these things, for example, are rolling. So rolling means if the baby is supine lying position. While playing, baby turn the baby to one side, right side and left side, and also these positions are going to be is inhibit the reflexes, and also this is going to be the reaching activities with any playful activities. So if the baby interesting toys, if you keep near to the baby try to reach the objectives. So these things are going to be improve the motor functions. And also next one is the sitting positions. If you maintain the proper sitting positions, if you encourage the sitting positions, so these things are going to be improve the strength in the trunk and also helpful to improve the tone in the neck and also trunk. And crawling activities, so these crawling activities are also going to be increasing the tone in the neck and also trunk regions. It gives the strength in the upper limbs. So if you see here in this like a prone and hands, so these prone and hands are going to be strengthening for the shoulders. And if you see here the neck control, so if you give this position, the baby is going to try to lift the head up. So this is going to be increasing the tone in the neck muscles. Promote the spatial perceptions and body awareness and mobility to facilitate play and social interactions, exploration of the environment. So these are things are going to be the spatial perceptions and body awareness. So where the standing and also what positions they have. If you create awareness, if the rocking movement, forward movement, and also rolling movements. So these are going to be, so if they when you hold the toys, if they are in a circular manner, if you rotate it, so automatically they can understand they're going to reach the object. So that means we are going to facilitate some motor functions so they can understand so how they are going to reach the objectives and how they are going to move. So these things we have to give the while playing. So on the roller or maybe Swiss ball. So if the babies move forward and backward, try to reach the objectives. So these things are going to be enhance the motor development. So the baby is going to try to reach the objectives, any like the bright color, like a toys or anything. This type of activities are going to be increasing the motor functions. And also next one is useful equipments. So that facilitate the functions when impairment is the preventing the development. Sitting on the adapter chair. So sometimes, so because of the abnormal postures, so if this are in the sitting in the wheelchair or maybe other like a normal chair, so it may use the is a further development of the abnormal posture. So if we give the like is like adjusted chairs. So sitting adapter chair, so different adapt chair. So here is going to give this is going to be this going to prevent the flexion deformities. And also if you see the bloster, so it's going to give is a prevent the adduction in the hip tightness. So it's going to prevent the scissorings and also maintain the erect postures. So it prevent the forward leaning postures. So this type of the equipments or devices and also is adapted chairs are going to be helpful to improve the motor and sensory functions. So practice the midline place, reach for the feet, and also suck on the fingers. So something playing activities with the kids. So ask them to if the baby follow the commands. So try to reach reach the toes, or in the long sitting positions, or maybe sittings. So maybe ask them to try to touch the toes, or maybe suck on the fingers. So these things are going to be the baby can follow our commands. The baby can reach. That means that they're going to follow our commands and they're learning what we are telling. So what we are explaining. So these things also going to be improve the motor functions. Do not give too many stimulus at once. So it may give the confusion to the patient, confusion to the baby. So we should not give the many stimulus. So for example, if you are showing some object one time, so you have to practice only one time. If you show one object, then you immediately, if you change this one, the baby is going to be confused. So we should not give the many stimulus. So if you give one task, after completing the task, so we have to go for the another task. Carefully introduce different surfaces for the child and roll on, creep and crawl, and also walk on with the bare foot. So if we give for example, the surfaces should be different. So we have to try to walk on the like a mattress, foam mattress. And also after that, we have to change the type of the mattress or surface, or the rubber mattress, or maybe it's going to be the mat, or maybe it's a hard surface, and also wobble board, or maybe it's the vestibular board. So the walking surface area should be the different textures. So the baby is going to feel that different type of the textures. So it's going to be helpful to improve the sensory feedback. So that means it gives the sensory feedback, helps to improve the sensation. And also always give the child time to time experience, that is a tactile, auditory stimulus, and let him to reach and find out about himself whenever possible. So we have to give the different type of the tactile sensations, different touch. So we have to give with the hand touch, we have to give the soft toy, we have to give like a small brush, or we have to give the like a hard materials, or maybe we can give the fur material. So different textures, different touch sensations we have to give. So the baby is going to feel the different touch sensations. One time with the toy, one time with the cloth, one time with the hand, one time with the brush, one time with the hard materials, or maybe wooden materials. So if you give the different type of the textures, the baby is going to feel the different type of the tactile sensations, and also auditory stimulus also. So sometimes we have to the different sounds. So sound should be the different stimulus. So one time we have to say something, but in the different manner. The zingles, or maybe with a musical, or sing, or song, or different stimulus audios. It also going to stimulus the response. So that means if we give the different stimulus, the baby is going to respond according to the stimulus. So these things are helpful to improve the motor functions as well as the sensory functions. Coming to the improve the proprioceptive and also vestibular functions. So improve the proprioceptive and also vestibular functions. So here there are compensatory stimulus for the visual impairment, and also develop the body image. So who are having any deficits, or especially the visual impairments, so we also develop the body image. So that means if they touch some things, so they're going to feel the image. So something, if you give the toy, so how the toy structure, what is the texture. So if you stimulate, they're going to learn how it will be. Are different of the textures, are coins, are the toys, are marbles, or pencil. So they can understand how the shape will be, how the texture will be. So and next one is touch, and also pressure, resistance can correctly given to the stimulus. Stimulate the movement, gives the clues as the directions or degree of the muscle actions. So if we give the train different type of the textures and pressures, so these things also is improving it stimulates the movement, and also it improves the degree of the muscle actions. So do not use the treatment with the handling or other proprioceptive stimuli from the behind, as leaning back will facilitate the extensor thrust. So while giving the patient in the abnormal postures, so it may should not give the treatment plannings. So especially the patient is leaning to the backside, so it may give the extensor thrust. And also visual development. So visual development, so we have to give some give the some this visual aids also going to be helpful to attract the patients. So these can be easily integrated with the methods of for the head controls and also hand functions and all balance and locomotor activities. So if the baby is in the prone lying positions, so if the baby is not concentrating, if the attention span, loss of attention span, or if the baby is unable to control the neck, so we have to maintain the baby in the proper prone lying positions. So these objectives, so these are the colorful, bright color objectives. If you show the baby, so if you show the baby, then change the direction of these toys. So if we lift it up in the prone lying position, the baby trying to lift the head forward. So these things are going to be stimulate the strength in that means it's going to stimulate the motor functions in the head and neck control. So it may improve the head and neck control. So and also in the if the baby is turning head is difficult to turn to one side. So these thighs are going to be the baby in supine lying positions. So try to turn to right side and left side. The baby is going to turn towards right and left. So it also increasing the range of motion and also it also helpful to strengthen the neck muscles. So this type of activities. So if we give this hand, if the baby is sitting or standing, if we ask them to hold the toys, so it's also going to be improve the hand functions. So the baby is going to reach. So who are having the incoordinations or is a difficulty handling techniques or any voluntary control loss. So these things are going to be helpful to improve the hand functions and also the balance and locomotions. So all these things are going to be helpful to improving the strength and also the gait pattern. So these things are related to the appropriate levels of the visual ability, the child's motor programs. So it will be depends upon the patient's conditions and status. So it will be different according to their visual impairments or maybe depends upon the muscle strength and voluntary control. So also one may have to accept the unusual head positions or other patterns which make it possible for the child to use the residual vision. So sometimes in the abnormal postures, if you are not giving proper position also, so sometimes it may affect if you give whatever you give also the patient won't give the proper, they won't get the proper stimulus. So use favorite toys or colors to facilitate the visual functions. So some kids are going to be attracted to the bright colors. Some kids are going to be attracted to some toys, different type of the toys. So if we give the toys or attractive colors, so the baby is going to be, so we can easily attract their vision. So if the baby vision is a difficulty or impairment, we try to stimulate the vision with the images or with the toys, we are going to stimulate and facilitate the vision. And also language development. So how the patient, if the baby having any difficulty in the any language or any cooing sounds or if any delayed milestones related to the language, so we have to draw a body chart. So we have to show what is the body parts. So which one is the nose, which one is the head and leg. So after that we have to demonstrate on the baby. So which one is the head. So what are the body parts we have to demonstrate and ask them to practice also with always whenever they while feeding and also while playing whenever the free time. So if they do all this communication with the baby, so the baby is going to learn about the body parts. It may help to improve the language. So always you have to give whenever the time, so how to make the different sounds and also what is the meaning of the word or term. So if you explain clearly every day, so the baby can learn easily, can easily develop the language development. Communication also is fostered and also through motor actions and also touch, body language relevant to sign system of the child. Sometimes if the body have the child having the complete loss of speech, so then we can encourage with signs, body signs. The baby is going to understand the signals. So that also easy to communicate with the mother and also parents. So easily communicate easily, so they can understand what they are going to give the signals. So this also helpful to communicate with the child. Facilitating the motor development. So we have to give some motor development. So depends upon the age group. So in case of within the 3 months, so we have to try to give the prone lying position to the baby. So after the shower, or we give in the free time, if we give the prone lying positions, so in the prone lying positions, if we give any toys or anything, the baby is going to try to lift the head up. So in these positions, it may develop to the head control. And also next one is on the forearm, in the prone lying positions on the forearm. So if we give the prone lying positions, keep them into the prone lying and prone on elbows. So these positions also improving the motor functions. These are also helpful for the strength in the upper back and also extensor group up. So strength the extensor muscles. And also have to give the hands and also hand and also knees. So that means the quadruped positions, how the crawling position. Normally at the age of, so in the last class we discussed about the milestone developments. So how the at the age of like a 6 months, so they are going to sit the support or try to like a 7th month, they are going to try to crawl and also creep. So if we give these techniques, that means hands and also knees positions, like a baby crawling position, they can move and also they can maintain the, if they may, at least if they're not crawling, if you maintain these positions, it may help to strengthen the like a muscle power in the back, in the strength, in the spine, as well as in the upper limbs and also lower limbs. So because of the weight bearing on the upper limbs and lower limbs and also back, so is going to be improving the muscle tone. So during the crawling, half kneeling, and also hand support during the at the time of the 11th, 9 to 11 months. So these are going to be increasing the muscle tone. And also in the bear walk at the 12 months, so he's going to be improving the like a stepping fun, stepping reflexes. So he's going to be enhance the gait pattern. So acceptance of the prone positions. So these positions going to be is accustomed a child to prone. So on the soft surfaces, sponge rubber and also inflatable mattress and inflatable mattress in warm water and over large soft balls and also over a lap. So these things, so in the prone position, so is going to be helpful to improve the like a prevent the like a flexor reflexes. And also rock and also sway baby held in the prone pose suspensions. So if we give in the rocking positions in the baby suspension, if they move forward and backwards, so this rocking chair also is helpful to improving the muscle tone and also prevent the exaggerated reflexes. Coming to the postural stability of the shoulder girdles, so we have to give the weight on the forearms at the 3 months. So we have to give the shoulder girdles. So we have to give the prone on hands, prone on elbows, and prone on hands. So at the age of the 3 months, is the prone on elbows, and at the age of the 6 months, prone on hands. So these are going to be improving the strength in the shoulder girdles and also improving the tone in the muscles. So, and also next one is on hands, knees, arms held in the stretched forward along with the grounded to hold a toy at the fifth to 6 months also, including the postural stabilities. So these positions are going to be increasing the muscle tone and also who are having the muscle tie like a flaccidity, or in case of the exaggerated reflex, we are going to prevent the abnormal reflexes in the flexor compartment of the muscles. Maintenance of the half kneeling, lean or upright kneeling. So these are at the 9th to 12 months are going to be improving the strength in the shoulder girdle. So these all exercises are going to be helpful to improve the strength in the upper limbs. And also stability, the postural stability of the pelvis. So if we give the kneeling positions, so these kneeling positions with the support of the chair, so it's going to give the stability in the pelvic regions and also the stability in the spine. So these are going to be stimulate the strength in the pelvis as well as in the, we are going to strengthen the spine. And also next one is the quadruped positions. So these quadruped positions and the prone on elbows and prone on hands also going to be give the strength to the pelvis and spine and also upper limbs. So both are going to be, so is get the strength. Half kneeling. So in the half kneeling also, if we give this one is, if you observe, if you analyze the movement, so this movement is going to be the, if you see here, the right leg is getting the weight bearing and also left leg is getting the forward. So here is going to get the weight bearing. So it gives strength to the hip flexor, in this case, the hip muscles, and also stretch to the hip flexors. So who are having the tightness hip flexors is going to stretch and also is going to be maintaining the hip extension positions. It strengthens the is a gluteal muscles. So these positions are going to be improve the lower limb muscles. So if you from the half kneelings, then half kneeling to the next progression is going to be the standing postures. So these are all the mat activities like a quadruped positions, from the quadruped position to the kneeling position to the half kneeling positions, half kneeling position to the is the standing positions. Then if we give the standing, so these are going to be the step by step, the progression to the cerebral palsy patients. and also maintaining the upright positions. So these positions are important to stimulate the motor functions. So these are going to be the adapted chairs and also standing frames. So to prevent the postural abnormalities. So these are the very, very important to prevent the postural abnormalities. So these are the adapted chairs, these are adjustable chairs. So we are, and also is going to be the standing frames. So these are standing frames are going, who are having tightness in the tightness in the hip flexors and also hamstring muscles and gastrocnemius. If you maintain these positions because of the weight bearing positions, so if because of the weight bearing the pressure points, so if the muscles are going to get the stretch and also it maintain the extensibility, so prevent the deformities. So these postures is important while who are having the tightness in the gastrocnemius muscles and also hamstring muscles, and also who are having the any deformities, especially in the spinal abnormalities. If we give, so we can maintain the erect postures. So use of the orthosis can be delayed until some voluntary movement is gained. So immediately we should not give all the orthosis. So we have to wait until some voluntary control occurs. So in these orthosis, some after getting the voluntary controls, so we have to give some orthosis. So you can see here, these orthosis are going to prevent prevent the plantar flexion in the ankle. So this is helpful to maintain the ankle in the proper positions, to maintain the stretch force in the gastrocnemius and soleus. So coming to the who are having the less balance or trunk support, or maybe who are having the lean, if any balance problems, so we have to train in the Swiss ball and also vestibular board. So these are going to be improve the balance and coordinations. So he's also improving the challenges. So day by day, if we train them, so they are going to stimulate the responses, so the motor responses. So according to the movement of the Swiss ball, so the baby is going to be respond according to the movement, either forward or backward or side to side. So he's going to tilt or changing the directions. The muscles are going to be stimulated. It may chance to get the strength in the trunk muscles. So coming to the preschool periods, so these preschool periods also in this one, we have to do some special educations. So here is the main aim is to reduce the primary impairments to prevent the secondary impairments. So if anybody the primary impairments, so we try to reduce the primary impairments. If anybody get the development, the secondary impairment because of the abnormal postures or because of the bedridden positions, if they're not taking the treatment properly, if they're not participating actively in the therapies, so they may chance to get the secondary complications. So our goal should be to prevent the secondary complications. So these things are increasing the force generations. So that means he's trying to strengthening strengthening. So this is depends upon the patient's the postures and also patient type of the cerebral palsy. So here we have to creating demanding in the both concentric and also eccentric work. So for the eccentric muscles and also concentric work, the muscles, so we have to give the proper positionings and also some movements. So against the gravity and also some activities on the balls, there is a gymnastic balls. So these the Swiss balls and also some against gravity movements are going to be increasing the strength in the eccentric muscles and also concentric muscles. It helps in the muscle strength. If the child has to have some voluntary control in the muscle group, the capacity for strengthening is exist. So, but sometimes we already having the spasticity or ethitoid type or dystonic type of the cerebral palsies. So they may chance to get the involuntary movements. So in those conditions, are may chance to get the unable to do the voluntary movements. So those things. So we have to maintain some strengthening exercise. If we give some static stability exercises, so we are going to prevent the abnormal movements, involuntary controls. So we can may increasing the voluntary functions. Use of the electrical stimulations are by strengthening within the synergetic movement patterns. So we are having some abnormal movements. So if we break down the synergies, so with some special techniques such as if you do the brainstorm approaches. So in this one, we are going to stimulate, we are going to break down the synergy patterns. So these different type of the techniques are going to be helpful to break down the synergy patterns. So we can control and also voluntary movements. So this is a special topic, the brainstorm techniques. So we are going to discuss in the neuro rehabilitation, different type of the neuro rehabilitation techniques. So we will discuss there. And coming to the ambulatory children with the CP have capacity to strengthen muscles, although poor isolated control or inadequate length. So sometimes we are having the poor control also. So we can give the some ambulatory aids. So these are also going to like a maintain the like a gait patterns and also maintain the stability. To participate in the strength training programs, child must be able to is compared to or consistently produce the maximal or near maximal effort. So if the patient is able to cooperate with the therapist or in the during the rehabilitations, so they have to understand. So at least they have to put the near the effort, no, at least near maximal effort. So then only the patient is going to get the proper like a postures and also they are going to get the proper strength. So, and also one more technique in the cerebral palsy. So most commonly we are having the tightness, so spasticity. So without reduction of the spasticity, we are not going to get the voluntary movements, and also we are not going to get the like a disability. So that's the reasons if we reduce the spasticity, we are going to like a minimize the tone, then we can get the like a postural control, and also we can improve the muscle like a balance, and also we are going to improve the ambulations such as the gait patterns. So we can bring back them into the normal the walking patterns. So these reducing spasticity techniques are important. So this spasticity management is going through the positionings in the anti-synergetic patterns. So positionings means, so especially just now we discussed the is like a reflex inhibiting postures. If we maintain the positions in the reflex inhibiting postures, so we are going to be prevent the reflexes, so we can improve the extensibility, we can prevent the spasticity. Such as example is just now we discussed, if we give the like a quadruped position. Or if you put the weight bearing on the hands, so it may give the stretching to the wrist flexors. So it may give the stretch and also extensibility in the this wrist flexors. It may give the like extensibility in the muscles. It prevent the tightness in the muscles. So because of this stretching of these flexor muscles, these extensor muscles are going to be stimulated. We will get the strength in the extensor group of the muscles. And coming to the stretching of the tight structures. So if you follow the proper positionings and also proper stretching techniques and the static stretching techniques, so it's going to be increasing the length in the muscles. So it's going to be helpful to prevent the tightness. So it will reduce and also it maintain the balance, proper balance, and also it improve the voluntary functions. So another technique is going to be the MFR, the myofascial releasing techniques. So if any myofascia is tightness, if any, so we have to do the myofascial releasing techniques. So if we do our tendon rollings, or if we give the friction massage over the insertion of the muscles, so there we are, if we do these techniques, so we are going to reducing the tightness in the muscles, so we can prevent the spasticity. And also ROM exercise, range of motion exercises. So if we do the rhythmic ROM exercises, is going to maintain the muscle properties. It will help to prevent the tightness. Rhythmic rotations. So rhythmic rotations. So if you, for example, the rolling of the limbs who are having the lower limb tightness, if we give the rollings or rotations of the internal rotation, external rotation of the lower limbs, so it also helpful to prevent the muscle tightness. So these rolling techniques or rhythmic rotation techniques are going to be inhibit the reflexes. Also, it's helpful reducing the muscle tone. So coming to the splinting and also serial castings. So if you maintain some splints to prevent the like a spasticity and tightness, serial casting, if you day by day, if you applying the serial cast, we are going to reducing the tone in the muscles. So if it is not controlled with all the like techniques, so surgical procedure is going to be the dorsal rhizotomy. So what are the fibers are going to be, the nerve fibers are the hyperactive. So surgically they are going to resect, are going to be some fibers are going to be cut. So the signals are going to be inhibit. So it's going to get the less amount of the tone is going to get. So it may lead to the decreasing the spasticity. And also another medical management is the Botox injection. So it's also, is mainly is the decreasing the spasticity. So this Botox is nothing but is going to be, so this injection is going to be reducing the muscle tone. So these are the muscle relaxants, helps in the relax the muscle and to prevent the spasticity. And also increasing the mobility and flexibility, ROM exercise and stretching exercise. So for example, ROM exercise is going to be maintain the muscle properties and also prevent the muscle tightness. So if any muscle weakness is there, if you give the strengthening exercise, so if you, for example, if this muscles are flexor compartment muscle tightness, if you give the strengthening to the extensor group of muscles, so if you give this is going to be strengthened. So because of strengthening of the is the agonist to antagonist muscles, so these muscles are going to stretch. is going to prevent the spasticity and also maintain the flexibilities. So prevent the deformities. So these deformities just now we discussed. So if we give the serial castings, so if anybody get the like a foot drop or like a because of the tightness of the gastrocnemius and soleus, so if we give the serial castings, so if you maintain the dorsiflexion, if you apply the POP applications, so day by day, so if you maintain the like a neutral positions or slightly is the near to neutral positions. After 2-3 days, again we have to remove the POP, then apply again. So it maintains if you maintain the neutral position again. If you apply POP, so 2 to 3 days, then again we have to change at least 2 to 3 days. If you maintain the angle is if you're 10 degrees to 10 degrees, so we are going to increasing the range of movement, and also we can prevent the deformities. So that is called as the serial casting applications. And also next one is the night sprint applications. So during the sleep time, so if we give some sprint applications, so to maintain the dorsiflexions with this night sprints, so we are going to prevent the deformities. So it will help to increasing the tone in the dorsiflexors, and also it improves the extensibility in the plantar flexors. It may prevent the help in the prevention the deformities. And also maintaining some is for this is for the lower limbs, and also this one is upper limb who are having the, so most of the kids are going to be made chance to get the flexion and also fist making, so it will give the deformity in the wrist. So if we give the strappings and also maintaining the web spaces, so we are going to prevent the tightness, and also we can prevent the deformities. So these are the different type of the techniques in the cerebral palsy. So these are some special techniques. So if we educate properly to the parents and also caregivers, if we train properly, so we are going to prevent the primary impairments, as well as we are going to prevent the secondary impairments. So these are the about the cerebral palsy management, and also some simple techniques. So that's all about the today's topic. Hope you understand clearly. If you have any doubt, you can ask me through the message. I can clarify your doubt. Thank you very much. See you in the next class with another topic. Thank you very much.